This is Talk to Kedi, sharing knowledge, liberating minds. Hello there. Thank you so much for joining me on another edition of your number one educational online broadcast, Talk to Kedi. Our topic of today is understanding urinary tract infection. In this edition, we'll be talking about what urinary tract infections are, their causes, the symptoms, people who are prone to them, how they can be treated and effectively managed, and also we'll be sharing with us steps or tips whereby you can be able to manage this infection very well and also improve your quality of life. My name is Felix Adedoyin. Welcome on board and let's get ready to learn. To do justice to today's program, today's topic is one of our senior lecturer. He is a passionate and award-winning distributor, someone who knows his onions as far as network marketing is concerned. He's no other person than our beloved Mr. ABDULKAREEM ABDULAZEEZ. Welcome to Talk to Kedi. You're welcome, sir. Have a seat. So, sir, can you introduce yourself to our viewers at home?
Good morning, sir. Good morning, ma'am, ladies and gentlemen. My name is ABDULKAREEM ABDULAZEEZ. I'm a senior lecturer in KEDI HTA, SI8 consultant, and I'm a member of Nigeria Council of Physicians and Natural Medicine, and also member of Lagos State Paramedical Practitioner. Thank you for bringing me.
Thank you so much. We are very glad to have you. You're welcome to Talk to Kedi, sir. And I'm hoping that myself and my viewers are going to be impacted by your sound teaching today.
Of course.
All right. Okay. If you're tuning for the first time, this is Talk to Kedi, your number one educative online broadcast, brought to you by Kedi Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and service in Nigeria. We are glad to have you all on board and stay tuned. Today, we will be talking about understanding urinary tract infections, a common health concern that affects people of all ages. Many individuals, however, they feel so unconcerned about it. They feel like they mostly ignore all the early warning signs, all the signs that comes with it. They ignore it. Sometimes some of them are shy to say it out until it becomes so uncomfortable or even sometimes more severe. So our goal of today, the goal of this broadcast today, is to ensure to raise awareness. Also, we want to highlight key symptoms that for us to watch out for when talking about urinary tract infections. And also, we're going to be sharing with us steps to reduce the risks and also to protect our overall health. Early attention and right information can prevent complication and also promote faster recovery. I believe you all heard that. When we attend to it early, when we know about it, when we know the signs and the symptoms, this can help us to avoid it, to avoid the risk of contacting it, and also to improve our overall health. So without further ado, it's time for us to take our statistics. So Mr. ABDULKAREEM, can you please read out the statistics that we have for us?
Yes. Based on these statistics, according to World Health Organization,
Yes, sir.
the available World Health Organization statistics as of 2025 says UTI are one of the most common infections in the world. Worldwide today is one of the most common infections, which affect about 400 million cases occurring each year across all the groups. UTIs are especially frequent among women, are the most common bacterial infection in women globally. Up to 10% of women may have UTI in a given year, and around half of all women will experience at least one UTI during their lifetime.
Wow, this is really
This means 1 out of 10.
Wow,
we experience in a lifetime.
In a lifetime.
In a lifetime.
Wow, this is really revealing. It is really. So, I'm so dazed with this information. However, The show has just started. Don't forget, you can be part of the conversation in the comment section. Please, now is the best time for us to start dropping in our questions. Do not wait until the program is about to end, or even after our guests are gone, before you now start bringing in your question. Now is the perfect time for you to start dropping your question about UTI. Probably if yours is contribution, probably you have tested somebody before and you're able to, you have treated a patient before and you have this testimony to share with us. Please feel free to start dropping in all your questions and comments. Likewise, we would like you to also share the link with everybody that you know. Click on the link, share it with your friends, family, on every group page that you have. Invite them to join this broadcast and let us all learn together about urinary tract infections. So without wasting our time, let's go over to our question. Mr. ABDULKAREEM, I believe you are ready, sir.
Of course.
Right. Let me take you to the first question I have here with me. It's in parts, but I will take it one bit by bit. I would like you to define for us what exactly are urinary tract infections and how does they happen? What happens in the body when someone develops this ailment?
Thank you very much. When we are talking about urinary tract infection, it's an infection that affects the urinary system of the body. Which when we are talking about the urinary system of the body,
yes,
we'll be talking about the kidney, the ureters, the urethra, and the bladder.
Yes, sir.
So it means it's a gastrointestinal problem that comes from the gastrointestinal into the what? The kidney and the bladder, which affects so many people seriously today. And when this started, let me take a case of a bacteria called Escherichia coli, E. coli as an example. So the moment it gets into the body, then the body is in another bad condition. It's not in a good condition again. You start having some kind of experiences like symptoms, like persistent urination, constant urination, painful urination, then abdominal pains, like that. Everything starts coming up.
Those are what happens in the body
once it happens to the body, you start feeling different reaction in your body, and that is the symptoms. You notice that no, I've not been feeling like this before. So the moment I started feeling like this, what is the reason for feeling like this? So it made this a stranger things in your body that you need to know what exactly it's all about, and that is what take you to the next level of what you need to do.
All right, can you dig us deep into those signs? You've started it already.
Yes.
Can you dig deep into those signs and the symptoms that a carrier of UTI he or she tends to see or to experience?
Thank you. Number one, pressure at the abdominal level is one of the things. Painful urination. You have not been experiencing that. You discover that you want to pee, and the moment you are trying to bring the urine out, you have started feeling more pains, serious one, and you have not been experiencing that before. Then that will call your attention that something has gone somewhere, which you need to watch, you need to correct. Not only that, you can discover that you pee and you notice some certain blood. Portion of blood coming out might be just little, might be as much as possible. Then it's another stranger thing that you have to look into and say what for, of course. And all these things, body sensation, you start feeling a kind of heat sensation in your body as if you something like fire is in your body system, and you have not been experiencing that. That's a sign that you have a certain infection in your body. It is not yet detected until when you want to do
the test and everything
before you can actually say, oh, this is the particular thing and this is the gravity of the problem.
Okay, I would like to add too. With my own little knowledge, I also know that sometimes the urination will be cloudy.
Yes.
Sometimes it's going to look so cloudy, dark, and sometimes some might bring some smell, strong smell, offensive smell. And another thing that sometimes you might also experience fever, pain, or maybe back pain and cold. Once we see similar symptoms or signs like this, just know that your body is fighting one particular ailment. Just like Mr. ABDULKAREEM says, you cannot say it is UTI until you are diagnosed of it.
properly.
Oh, okay. All right. So this takes me to my second question, sir. So the second question is this: what are the common causes or triggers of UTI? And also who is most at risk of developing them and why?
Yes. The common causes of UTI are numerous, but we are going to look at some major ones.
Yes, sir.
Now, the bacteria entry. So it means when you have certain bacteria that has already get into your body system,
Yes.
that shows that infection has come in. Then, entering of bacteria can be determined by your habits or your action, what you take, what you do. Now, another aspect we look into is the maybe you have a new sexual partner, or you have multiple sexual partners.
Okay.
Through this, you can contact infection, and this infection comes from either one of them or the new person, because before you don't have a partner, a new partner, so you are with your normal life way of living. Then you didn't feel anything, you didn't feel anyhow, you didn't have any symptoms, any sign. So the moment you notice sign, then you have to send back recap about what has happened within a few days or few months. Okay, you and who have sexual sex together? Is it one? Is it two? Is it three? From this source, you can actually have infection. So bad hygiene, when you don't have good hygiene, can also bring about the causes of infection. You see anyhow, you pee, any bad environment, you toilets, and you didn't bother about taking care of your private part, your privacy, then you can actually have infection from all these angles.
Okay. So who are most at risk at this of contracting UTI?
The women are the most risk of contracting UTI. Ladies, women. Why? Because they have an open body.
Okay.
Mostly compared to men. So, and because they have an open body, so they cannot just open anyhow. So they have to be in a hygienic way, covering way, and monitoring way for them not to have infection. The moment they don't abide by this rule, they are prone to have UTI infection.
Okay, I get it now. I'll also like to have to this information again. Like we said earlier that what happens to the body, like he said, once this bacteria enters the urinary system of an individual, especially the women, like we're saying that most at risk, but everybody in general, once it enters the body system, the next thing is that it multiplies. And once it multiplies, it causes inflammation. And when the inflammation happens, automatically you start feeling all the symptoms that Elijah said earlier. You start feeling them, all the burning sensation, all the frequent urination and pain and cold. You start feeling all these things. However, now with women being most at risk of contracting UTI, this is because our urethra is very small. The length of the urethra is so small, close to the anus, thereby allowing the bacteria to swim easily to the private part and then into the body system, then start causing all these ailments. Unlike men, whereby our own urethra is long, it's about 20 centimeter. That's the length of a man's urethra. So before the bacteria can even swim down to the bladder or to the anything, it has already collapsed, it's already destroyed. Unlike women, theirs is just like 4 centimeters, very short. In small time, between a little period of time, it has swum down there and cause and spread, multiply and spread and cause a lot of things. So because of the closeness of the urethra to the anus, this has really made women to be so prone to contracting urethra. And like you said also, their sexual activity, when they have multiple sexual partners or new sexual partners whom you don't know their own health status, you don't know what they carry, you don't know what is in their body system, you don't know, you just jump at them because you are happy, you are delighted, you are so into the relationship. Before you know it, we are we are affected with a lot of these things. So we need to be very, very careful. So this takes me to my third question. Knowing for the fact that women, we are prone to it. Also, men, we are not. It's not said that men are not prone to it, because when men contract this thing, the private parts, the penis starts having some things on the body, on the surface of the penis, because they are already exposed to this infection.
Yes, another one is urine retention.
Thank you, sir.
So
urine
some
retention.
people have the habit of holding urine for too long, maybe due to the nature of their work, the activities they engage in. Just feel like, oh, when I'm through, when I'm done, I'll go and pee, I'll go and urinate, and it takes hours or minutes. And this one will retain a lot of bacteria in their system, which is fluctuating up and down. And as a result of it, they will have series of pain.
So we've ended. So please, I'm still telling us, for those of us watching us right now, if you have any question, start dropping your question. Do not wait until I start asking us to drop our question or until our guest leaves. Start dropping in your question right away. And if yours is contribution, or you have testimony to share with us, please start dropping your testimony now. Okay, this takes me to my third question. My question is this, sir. What prevention tips or daily habits can help reduce the risk of developing a urinary tract infection? What tips could we share?
Some of the things you need to do to prevent urinary tract infection, which we know as UTI. Number one, anytime you go to toilets, you want to, whatever way they pee or you want to defecate, so make sure that you didn't wash from the back and from the front back.
Okay, for women.
Yeah, women. Okay. Wash back and front back, not back
to the front.
Because if you are washing from the back to the front, you have the chance of contacting that infection, because it can easily spread, moving into the into the urethra. But if you wash from the front back, you are washing it away. So that is one of the first things. Number two, if you are the type that you have multiple sexual partner, then you have to first of all engage that person in proper medical checkup, at least for you to be sure, that, oh, this person I'm dating or I want to marry is not having a particular infection that can also affect your life. If you are the type that you wear, you put on thick underwear, very thick underwear that can generate a lot of heat and so many things, you have to make sure that you wear something light that is not too tight, like cotton. And not only that, you take plenty of water. According to research, individuals are expected to take at least up to 5 liters a day of water. But it depends on your body capacity. So you might not actually meet up with the standard recommended, the standardization, but you at least you can try to take as much as possible. You can take, so that water can flush out a lot of toxins and bacteria out of your system. So if you are the type that you pee anyhow, you just see any place, you open your skirt or your trouser, you just have to be cautious. Make sure that wherever you want to defecate or you want to pee is a very clean environment. So these are some of the prevention you have to take. Not only that, in preventing, you have to do a proper diagnosis. So when you notice this sign, then you can look for a way of checking yourself up to know the gravity of the problem, so that you can be able to know how to address it. So these are some of the preventive measures that you can take.
Wow. All right, that takes me to my fourth question. When it comes to urinary tract infection, at what point should someone seek medical attention? You're already given us the tips to do, but at what point? Because like I said earlier in my introduction, many people, they just ignore. They don't want to talk about it. They don't want to go out on tests and go until it becomes so severe that many people now start seeing on them and say, Mr. Man, Mrs. Woman, what happened to you? You are this, you are that. So at what point when should someone seek for medical attention, and what are your own recommended treatment options? Let's start with the first one.
Yes.
What point?
The moment you notice any sign in your body, any strange sign in your body, then within 24 to 48 hours of that sign,
that particular sign,
yes, then your attention needs to be what? Doctor attention needs to be called. You need to meet your doctor or go to hospital or nearer healthcare center you use and lay your complaint so that they can know what to do.
Yes,
then that is number one step. Number two, when the situation gets severe, you started having it in a serious way. You are having the pain over and over. Then don't just think of it's normal or I'm experiencing another thing. Immediately run out to your doctor or your healthcare center or where you can have solutions to it. Then the next thing will be done. Then the third one, maybe you have tried some certain things like taking water, cleaning yourself very well and all the likes, and you discover that yet no improvement. Some people even fond of getting some certain things and use. It could be a drug, it could be some herbs, ginger, this and that. You mix them and you still discover that despite this, there is no solution to the problem. No difference. It's the same thing. Then that is the time you need to watch. You need to seek for medical support on that.
All right. So with this, only that when the symptoms last for like 24 to 48 hours, you are still experiencing it, or the pain, the things the person is feeling is still persistent despite some first aid treatment that you have levied to it. So now, the second part is that what medical treatment now would you recommend? What treatment options would you recommend?
Yes, that's
in scenarios like this.
That depends on individual.
Okay.
Some people are fond of I have to go and see my doctor in the hospital in the line of orthodox medicine and the likes. They refer you to the lab, which are going to do some series of tests like UNMC like eye vaginal swab test and the like, just to know the kind of infection you are having and the level. Is it acute? Is it moderate? Or is it severe?
Exactly.
So the moment you do that, then you'll be able to the problem will be identified.
Yes, sir.
And when the problem is identified there, so the referral doctor will be able to tell you what to do and the method of treatment that will be given to you. Exactly. Some people prefer herbs, and despite they prefer herbs, they still need to wait for diagnosis.
You should go for diagnosis.
After diagnosis, then the person refer them, we prescribe the natural herbs they want to use, and that is the thing the person is supposed to do.
Okay, all right. Despite all this, though we know there is first aid that people can go into. We are told normally once you feel anything, you should first use what is called first aid treatment for yourself. But majority of us, we have not leveraged on this so-called first aid, and we tag it as we do not know that it is becoming you are self-medicating yourself. So this takes me to my next question, sir. So when many people self-medicate, but when they suspect it's urinary tract infection, we know it is very dangerous. So my question now is that what are the dangers of anybody that is self-medicating themselves? What are the dangers when they don't go for proper treatment?
Yes. There are a lot of dangers in self-medication. Number one danger is this: self-medication is not actually the treatment. It's just a preventive measure. Just for you to get to the nearest place where you will be given better treatment. So it's not something that lasts so long. So it's just within some hours or just a day. Then after then you are still having the symptoms and the challenge, then go for normal treatment. So one of the danger is that some of the medication you are taking might not be the right medication.
Of course. That is the bottom line.
So when you are not taking the right medication to treat yourself, the medication you are taking is treating another thing entirely. So which may be attacking some other organs in the body.
Of course.
Then it can lead to chronic kidney disease. Because kidney, liver, all these are vital organs in the body.
Of course.
You cannot just handle them anyhow. So there are some powerful antibiotics you are taking that is overdose for the kidney,
or
to
the
make use
liver.
of and the liver.
Mm.
There are some that is toxic to the kidney and the liver, which you think you are treating infection, but you are destroying the kidney and the liver. And that can actually affect bringing down your immune system as well.
Of course.
And when the immune system is down, then the infection that you say you are treating has opportunity to spread over again. So you discover that you are using some medication and you are damaging your system. This is one of the danger. And if this sets in, it can become a life-threatening problem that you continue to move from one clinic to the other, one hospital to the other, one medication to the other, and you spend a lot of money, you waste a lot of time, and at the end of the day, you might still lose your life.
Wow. So we have seen the dangers of self-medicating. Like for instance, the person might be treating having one other ailment in his body, and you thought you are treating the infection, whereby you are treating something else. That's another point.
Yes.
Another point is not that you might be affecting your kidney because of wrong treatments that the person is focusing on it. So another thing is that some people, some medicine that some people are using, the body is already resistant against it.
Of course.
There's some antibiotic resistance that is happening.
Yes.
So the person might be using the product, that particular drug, and yet it's not treating anything. And for the person, you would think that, oh, you're already treating yourself. I'm already using what I want to use.
It's still a carrier of infection.
And you're still carrying, the person is still carrying the infection. So, like like you said, once all these things happens, it damages the kidney.
Yes.
It helps the infection to spread all over the body. And at the end of the day, it might even result to some unnecessary side effects. Yes. Because the person might be treating headache now. And before you know it, will turn to another thing entirely. You now start treating many multiple infections.
Spending more than the normal cost expected.
All right. So with all this knowledge, this will take me to my next question. But before then, I would still like to tell us, please, if you have questions and comments, please kindly drop your question and comment right away. So this takes me to my last question, sir. My question number 6. With all this roving about, knowing that self-medication is not right, it's not good, but you, as a renowned KEDI consultant with many years of TCM experience, I would like to ask you, we know that KEDI offers some products that helps to manage UTI, UTI infection. So in what situation would you recommend this product? The product that KEDI has. So now just let us know the product that KEDI has that handles this UTI infection that we're talking about, and in what circumstance would you recommend it? Having tell us the situation that you're going to recommend it, we'd like you to also share with us the dosage use of this product, and also if you have any testimony, probably you have dealt with one patient or the other, and you have testimony to share to help our viewers. So please go ahead, sir.
Thanks to KEDI Healthcare for having wonderful products today in our country and in our society.
Yes, sir.
So based on my experience, we have a lot of wonderful products that can handle UTI infection. Okay. But before I started administer or advise you giving out any product for any treatment of infection, number one is that the moment the person gets to you with the complaint, the first thing is find the root cause of the problem.
Yes, sir.
Don't just think that, oh, I heard a lecture that say when you are feeling this, you are having this. So this is what you are taking. No. So the first thing is I ask the person, have you done any tests before? If yes, go through the medical history of that person to know what are stated in that medical history, so that you know what you are treating. If the result is far ahead of the moment the person comes, another new test.
But you don't run another test.
Yes,
a
fresh test will be suggested for the person to run in the lab, in the standard lab.
Exactly.
So when the test comes to you, the result, the outcome of the test will determine, oh, this is the level of infection. Now, it should not be based on the option of using our own KEDI product, because the person actually believes in you, that you have solution. That's why the person comes to you. Yes. So one of our products, we look at the test first. It's still acute stage, just a mildly infection, or just a moderate infection, or just a severe, very chronic infection. If it is just a moderate, a acute infection, we have powerful Reshi there. Just ordinarily a bottle of Reshi and trash it out of the system within 3 days, 4 days of using Reshi. Because Reshi is a natural antibiotic produced by KEDI Healthcare. It's an organic product certified and NAFDAC approved without any side effects. So when you take Reshi will solve the problem. When the state is at moderate or severe, just giving around Reshi might not actually solve the problem at that point in time, because we have the infection infected the body system. It's too much in the body system. That takes you back to detoxification. So you have to flush,
detoxify the person first
with a first colon T that has to work on the gastrointestinal tract to flush all the the whole system. You can include gastrifox as well. So when you combine these two together, then you'll be able to ease out the body will be relieved
of some chemicals in the body, some substance, because of the person's use of some other drugs.
Other drugs that are resistant to some other medication. So it will have been flushed out of the system. Then you bring in Reshi. You bring in Reshi after detoxification. You won't combine Reshi and detoxification together.
You detoxify it
because in putting Reshi and detoxification together, you are also detoxifying Reshi out of the system. That's true. You didn't allow the Reshi to work, to perform its duty. So you first of all allow detoxification to go like about 3, 4, 5 days. Then you can pause it, then bring in Reshi. Then when you bring in Reshi, if it is for man, you are treating man, Reshi, that's okay. But if you are treating women, Reshi and Gynapharm will be combined together. Because Gynapharm has ability to work on the female reproductive organs. And we are dealing with women now. So we have to include Gynapharm. Reshi and Gynapharm will come together and you recommend the usage. And when you recommend the usage, then the person will feel better. So because you are dealing with moderate now, after taking Reshi and Gynapharm, finish, you go back to that detoxification. You detoxify again, then you replace Reshi and Gynapharm back. Then you can now tell the person to go back to the lab
and go and check if he or she is still having that infection,
or completely out of the system. If the person is completely out of the system, that's great. Then you can still place the person on preventive measure, because KEDI product has 4 major areas you have to look into. Number 1 is our product is restoration in nature. Our product is good for elimination of so many bacteria and toxins in the body. It's also preventive in nature, and it also has some curative ingredients in it that can be curative. That's why some people tell you that I've been battling with this for so many years, but thanks to KEDI Healthcare products, since I use those products, I didn't have the symptoms and the disease again. And that is the area you have to look into. So in taking Reshi now, if it is acute, just twice a day. That is morning and in the night before food. 3 in the morning, 3 in the night before food. It can be an hour or 30 minutes before food. You can take it to ordinary water, and preferably if you like warm water, little warm, just above the room temperature water, you can take it. But if it is moderate, then it means Reshi has to come 3 times daily. 3 morning, 3 in the afternoon, 3 in the night before food. Then likewise with Gynapharm. So Gynapharm can be taken as 2-2 and it can be taken as 3-3. So if you are taking in 3 times daily, you might take it 2-2. And if you are taking twice daily, maybe due to the nature of your work, you might take it 3 morning, 3 after 3 in the evening. But you have to make a little bit space between Reshi and Gynapharm, because Reshi is an antibiotic, so that they will not work at the same time, so they will not clash, so that it can have free flow in the body system. Then in terms of taking colon T, then you prepare colon T, a sachet of colon T overnight. Overnight, you can prepare it during the day, but it's better at night because it might make it to purge a bit. So you take it after food, last thing in the night. Before you go to bed, and before you wake up in the morning, you think you discover that it has done a lot of the work, and you just have to go to toilet and evacuate all those batting in the system into the toilet. And that is it. So a sachet of Reshi of a colon can take you like maybe a day or 2 days, depending on how you put the water. Then go back to gas refort. Then gas refort can be taken 3 times 2 or times 3 daily, depending on the severity, the degree of the problem. Then you take it before food, morning, afternoon, night. 3. If it is a moderate or severe, if it is just an acute, just 3 in the morning, 3 in the night before food. And we come here to thank us that KEDI Healthcare product is really working well. I have a lot of.
You have some testimony to share with us.
I have a lot of clients around me every day as a medical practitioner. So I have a lot of people that comes to me with infertility cases, because one of the things that used to cause infertility problem for women or for some men is infection, long time infection, untreated infection. Or proving to be to be treated to be treated when you are used so many things and your body resists it. And by the time it comes to me, I detoxify them first. When I say that it's a long problem and it's really challenging, then I place them on the product. There's a particular woman that has been looking for the fruit of the womb for good 10 years. And someone brought her to me. Bringing her to me after proper checkup, go through his medical history, then I detoxify her then, because it's also someone that is very fat. So I have to check the BMI, body mass index of that person. So margarine was included, gas refort was included, colon was included, including constants. So I make almost 4 products as a detoxification program for her, and she used it like for about 10 days. Then I place her on Dynapharm and Reshi for 28 days. The same thing with the husband. At the end of the Reshi and the Dynapharm, I have a testimony that doctor have gotten pregnant and they deliver a bouncing baby boy, which I was also invited to that place as a oversight and for the naming celebration. And today they have a lot of children. So they are rejoicing with KEDI, Nababa and Bonge. So they are promoting KEDI everywhere. They have, even they travel out of the country, they are still talking about KEDI here. They are still referring people to us. So if you are watching us here and you are having these kind of challenges, or people are having this kind of challenges around you, don't try to contact us in KEDI Healthcare. We have solution for you. So our product is working. So and after treating them successfully, we still put them on preventive measures, because there is an adage that says there is no incurable disease, but incurable patients.
There is no incurable disease,
but incurable patients. Because some of those people that comes to us at times, they go back to their usual life after treatment. And that's the reason why they have that same problem coming back again. Somebody has multiple sexual partner now. After you complain this and that, you treated the person, but the person didn't change their habits.
Of course, they still go back.
The disease can still
come back again.
So that's of course, that's why we have to place that person on preventive measures, so that after 3 months or after 6 months, make sure you revisit our product, like either you detoxify yourself or you take our full Reshi, and anything like bacteria, viral infection, fungal infection, just about to grow in your body, to immediately be resistant.
Thank you so much. Wow, indeed, we have heard it all from Mr. ABDULKAREEM ABDULAZEEZ. So let me just pause a while and take a few of our contribution or our comment. All right. As we wait for your contribution or your comment, I would also like to take this part of this of my message, which is for you to explain the more for us, sir.
Yes, sir.
Explain the more. Why do women get UTI more? I have my question here. It's not
Okay.
in your why do they? Because they are prone to having it. I want you to explain the more. Why do they have it more?
Yes, they have it more. Number one, because they are the type that they have a very fragile body, very sensitive body than men. Maybe because they are also high in population, I don't know. There are many in population today. So, and some of them are not worried about their body system. They use the body system anyhow. Some have some threatening problem in their body already. Like some of them used to kind of lifestyle, modern lifestyle. Someone with diabetes, someone with high concentrated of sugar, high level of sugar in the body can have more infection. Infection can have ability to grow in that person's body than someone that doesn't take all these junk food. Like, and you know, our women, just testosterone any woman, where should I take you to? Say, take me to that tree, take me to this and that. So some of the things they eat, their lifestyle give them the kind of chances of having infection time to time. And it's very difficult for some of them to change this particular things. Some of them are not that hygienic. They might be public hygienic, but when you get to their privacy, you discover that they are not clean at all. So some of them can wear underwear for more than a day, 2 days. Some of them they went out and they discovered that they are wet, maybe through sweat and whatever. They didn't bother to change. All these things has to change it. If they don't change their lifestyle, then they will continue to be having growth of infection time to time. And they are very sensitive, as I said. So since they are very sensitive, so they are easily contacted infection than men.
All right. So now, the second part of this, my whole question now is, now we are addressing this to women alone, but we know this infection cuts across all gender and age group. So now for the men, what about them?
Yes, men can
the way they contract it, how they can avoid it. What about men? Because some men too are not hygienic in nature. Of course. They are rampant everywhere. They are not hygienic at all. You stay beside some. Even in public transport, you cannot sit down beside them. Of course. Because what is coming out of them is uncalled for. So what about men like that? How do we address that?
Mostly men do contacted some of the bacteria through sexual intercourse. Mostly. Okay. Because we don't used to have a kind of open private parts that anything can easily come in. So a man is easy to urinate anywhere, anyhow, and just. But aside from that, cleanliness is also part of the thing. Many of us will just urinate without even bother of taking water, ordinary water, and clean our privacy, maybe our penis or our surface, which is very, very bad. So if you are the type that you used to have multiple ladies around you, you go from one to second, from second to third, then it's easy for that kind of man or gender to have that infection. If you are the type that you have it already, then you don't bother about treating it because it doesn't give you any symptoms or any sign now. You just rather, I'm healthy because maybe your immune system is still strong at the moment. You have a very strong immune system, so it doesn't give you any feverish or any pains, anything like that. You might think you did not have it. But as time goes on, when the immune system drops, those are able to conquer immune system, then start having different reactions in the body. That is why it's not about you have infection or not. It's advisable every year, at least twice in a year. Be it a woman or a man, is advisable to do what is called medical checkup. Random checkup. There are some simple checkup that you can do to know whether you are started having infection or you are not having infection at all. So if there is any traces to any of infection earlier detected and easily be eradicated. So and when it's still long, it causes a lot of problem in the body. So men also have the chance of having that infection. And in case of men in our product, the same process is also, the only thing that will not be included for men is diaphragm or using our sanitary pad. So Reshi can be given, Polonti can be given, Consilins can be given, Gastrifor can be given, like the way you give it to women as well.
All right. So before I wrap it up now, sir, we've talked about men and women. How about children? Can they be susceptible to it at all?
Of course.
Like, take for instance a whole family. Imagine a whole family being infected somehow. Is that possible?
It's very possible.
So let's look at the children.
They might be their families and they have something in common, which their toilet is in common to them. So imagine these small children goes to the toilet without the permission of the parent, or even with the permission of the parent, they just go direct into the toilet and they just open their bottle and they just begin to pee or defecate inside the toilet without any preventive like sanitizing the environment before. So the first person that is a carrier releases the bacteria there, another person take it as a carrier, and before you know it, another person can come. So the whole family can have the same problem. So once you discover that the father has it, the mother has it, and they have small children, they are also prone to have that challenge. It means the whole family must carry themselves to what? To clinic, to do what is called medical checkup, so that they will know who is
tackling with one to the other,
so that they know what to treat.
All right, in case you just tune in, this is the Talk to Kedi, and our guest, Mr. ABDULKAREEM Abdulazeeez, has exhaustively discussed with us understanding urinary tract infection. Thank you so much for tuning in. Before we close, it's time for us to take our Dr. Cap tip for today, sir. So, sir, could you do us the honor of reading out Dr. Cap tip? It is also right here on the screen. Okay, for
listening to your body. Don't ignore any discomforts, pain, or unusual changes. Early diagnosis and treatment prevent complications. Always remember, taking prompt action today protects your health tomorrow.
I take it from there. Say, always remember, taking prompt action today protects your health tomorrow. With that, it is a wrap on today's edition of Talk to Kedi. I hope you have learned something valuable about understanding urinary tract infection. Special thanks to our wonderful guest, Mr. ABDULKAREEM ABDULAZEEZ, for taking time to share with us from his wealth of knowledge. Thank you so much, sir.
I really appreciate you for bringing me here today again.
Thank you, sir.
God bless you.
We're so glad to have you. All right, in case you enjoyed the broadcast in this, please don't worry. The full video will be available on our Facebook page at Kedi Healthcare Industries. It's also be on our Instagram handle at Kedi Healthcare_official. Please feel free to check our YouTube at Kedi Healthcare. You can also log into our mobile application, Kedi Care app. Feel free to watch and share with your loved ones. Don't forget to join us in the next edition of Talk to Kedi, because it promises to be insightful. Thank you so much for tuning in. Until I come your way next time, I remain Felix Adedoyin. Bye for now.
Thank you. Bye.